Okay, so next we're going to talk about fecal testing. So what this is looking at a stool sample. So this helps detect bleeding or obstruction in the GI system, if a patient has parasites, if they have conditions such as ulcerative colitis or gallstones or other GI disorders. The stool consistency can depend on the diet and normally is kind of malleable, which means it's kind of soft and not overly mushy. It has a defined shape and generally um, evacuation of the bowel is about 100 to 200 grams a day. Not every person has a bowel movement every day. It can still be normal to have a bowel movement every other day. Everybody's going to be a little bit different. Now, when we're looking at fecal testing, they're looking for stool abnormalities. So is it pasty? If it's pasty or light colored, it could have a high fat content. If it's greasy or tar-like, it has kind of a buttery texture. It could be caused by cystic fibrosis, extra mucus or phlegm that's going through the digestive tract and mixing into the feces. If it's bulky and frothy, it could be due to celiac disease. Diarrhea is a rapid passage of the evacuation of the bowel, and it's got lots of water. Sometimes they call it watery diarrhea, which to me is kind of redundant. It passes through before that water can be absorbed. Other types of abnormalities, a narrow ribbon-like evacuation can be due to a spastic bowel, decreased elasticity, rectal narrowing or stricture, or even a partial obstruction. So it's kind of extruding that bowel movement out through a restricted size opening. Small ball-like feces could be chronic moderate constipation, and excessively hard feces can be due to slow movement through the colon, which causes extra fluid to be reabsorbed out of the bowel. So looking at all this now with the small ball-like or the excessively hard, if there's that creates constipation, which part of it could be due to diet, not getting enough fiber, not drinking enough fluids, um, being dehydrated, but there's also complications, especially with the excessively hard bowel movement, because it could cause straining, which could result in hemorrhoids or even things like a hernia. So there's a lot that can be determined. We look at the testing the stool pH. The pH of the stool can depend on the diet and the bacterial fermentation in the colon. A normal value is going to be neutral or slightly alkaline, so 7 or above. Acidic could be that there's excessive carbohydrates. Alkaline pH could result of excessive proteins. Just like with urine, the color of the stool may also help identify something may be off. Normally, the color of a stool is brown. Food or dyes in foods could cause some variation in that color. But when it comes to abnormalities, if the stool has a yellow or a yellowish greenish color, it could be a breastfed infant, bowel sterilization due to antibiotics, and it could also be due to severe diarrhea. Green stool could be due to severe diarrhea, antibiotics, or eating your deep green leafy vegetables like spinach could cause that, or kale, or some of your other chlorophyll rich vegetables. Tan or clay colored stool could be an obstruction of the common bile duct, pancreatic insufficiency, or excessive fat intake. And if the stool is black or perhaps tarry, it could be indicative of an upper GI bleed, coagulated blood. Ingestion of iron can cause the stool to be dark in color. A high protein meat diet, um, ingestion of iron is on there twice. I have no idea why. Or charcoal or bismuth. Bismuth is an ingredient in Pepto-Bismol, bismuth subsalicylate, which is pink going in, but once you mix it with everything else, can turn to a blackish color in the stool. Now, if the stool is red, that's generally indicative of a lower GI bleed, current bleed. It's not coagulated. If it's streaking on the outer surface of the stool, it could be hemorrhoids or fissures that are associated with an anal pathology. If the blood is mixed throughout the stool, it's probably something going on with the GI tract. Now, when we do fecal testing, we actually can test for blood in stool. So there's going to be a normal value, getting rid of some blood cells and things like that. We want it to be less than 2.8 milliliters in a 24-hour period. Any amount that's greater than 2.8 milliliters is abnormal. And it could be occult, which means that it's hidden in the feces. Common causes of blood in the stool could be hemorrhoids or those anal fissures. Again, that would be on the surface. But if there's dry blood in the stool, that could mean that there's perhaps an ulcer or some other challenges somewhere further up the intestine. Just from pure experience, a GI bleed, the smell of the feces or the stool can also be kind of one of those things that can be an identifier. You know, depending on what you eat, you may have pass a stool that has a stronger odor than some other ones. It's kind of a delicate subject. It's not an easy one to try to pick the right words to describe it. It's not exactly dinner table discussion, but it is important. Now, most people at some point have experienced the smell of diarrhea, which is not generally a pleasant odor by any stretch, but the smell of blood, especially dried blood in the stool, has a very distinct smell. So a GI bleed, if you ever experience that, and working in the hospital and being down in the ER, you know, you get all these different smells, but if you ever experience that, it's one that is very, very, very identifiable. So that can also, even before they do the blood test, it can kind of give the people a heads up that something's going on. So with that, they can do a fecal, occult fecal test. So testing for blood in the feces is one of the ways that we can use to detect colon cancer. A false reading can be the result of ingestion of red meat, especially if it's rare, large doses of vitamin C, or inorganic iron. Conditions that can lead to blood in the stool may include the cancer, especially colorectal cancer or gastric cancer, colitis, specifically ulcerative colitis. It's sores or ulcers in the colon, so they become irritated, inflamed, they could bleed. Diverticulitis or diverticulosis, which are pockets where things can get trapped, like seeds or something like that. Again, they can get inflamed and they can get aggravated and they could bleed. Ulcers could bleed, and gastritis could cause bleeding as well. Mucus in the stool, generally there's not going to be any. There can be some secreted as a result of parasympathetic stimulation. Generally speaking, mucus in the stool is a translucent or gelatinous substance that can be a result of emotional excitation, excessive straining during the bowel movements, mucus colitis, or spastic constipation. Mucus mixed with blood could indicate inflammation of the rectal canal or in cancer. When mucus is mixed with blood and pus, it could indicate cancer of the colon, colonitis, diverticulosis, dysentery, which is a bacterial infection, or an amoebic infection, or tuberculosis, intestinal tuberculosis, which is generally in very rare cases.